Everybody, Dr. Dusty Mattingly here, and this is Loretta, and I'm going to do an adjustment on Loretta, okay? So here we go. How's everything doing there, Loretta? Good, okay. We've already done pressure points on her, and we did some traction on her already, so she's all ready for an adjustment now. All right?
All right.
Okay, so now I'm going to put some shoes on Loretta's feet here, and yeah, you're going to be able to tell which leg is short a little bit easier with these shoes here. Okay, now, so what we're going to do first is evaluate the leg length here, and turn your head to the right. Good, turn your head left. Good, back to center. Now when I had Loretta do that, she's got a right short leg, and the legs became even when she turned her head to the right and to the left. And so what I'm going to do, I'm going to adjust the upper cervical spine right now, and I'm going to set this drop piece up. Okay, now let everything relax there, Loretta. Push right on here. Okay, right on the occiput. Here we go. Okay, good. All right, now I'm going to do a little bit of an adjustment with the lower area. Here we go. Okay, there we go.
Oh.
You okay? Feel that there?
Yes.
Good? Okay, excellent. All right, now just a little bit right here. Okay, good. All right, now let's go recheck her legs. Okay, now turn your head to the right. Good, turn your head left. And back middle. Okay, so now she's got a right short, and the right leg goes just a tad shorter. So that's telling me something about the alignment of the right side, the right SI joint. So I'm going to go ahead and get that adjusted here. And I'm going to use the drop mechanism. This is a Thompson table, a Thompson 420 table. It has pneumatic air drops. So what I'm going to do is push right here. Okay, let that relax there. There we go. Okay, drop in there. Here we go. One more change that. Okay. All right, here we go. All right, good. Now this is a two-part adjustment, so I'm going to cross that leg over like that and contact right here. Okay. All right. Okay, now. All right, how's it going?
Good.
Doing okay? Good. All right, let's do a little knee check here. So what I'm going to do, I'm going to go ahead and adjust Loretta's knees here. And we're going to use this pelvic drop piece here. Okay, so here we go. All right, so good. That's basically a knee adjustment. I adjusted both of them there. Okay, now, okay. So what I'm seeing now is that her leg lengths have switched. Now she has a left short, which is a pretty common thing for people to, as you start to realign things, their leg lengths can change and the compensations change. And so now she's got a left short, about 1/4 of an inch short, and then when I go in the second position, it goes long. So I'm going to be adjusting her left SI joint here. Yeah, because that brings it right even. So I'm going to set the drop piece up here, and again I'm going to contact here and make an adjustment with this right here. Okay, here we go. All right. Okay, so that's doing better. That's pretty even. Okay. Now, Loretta, I'm going to have you roll onto your right side, okay?
Okay.
All right, so let me put this down. Okay. Now I like to stand right by the patient, make sure they don't fall off the table. You haven't fallen off yet, have you?
No.
Oh, good. Okay. Okay, so Loretta's being very gracious in letting us, filming her being adjusted. So here we go. Now, what we do with this is called a side posture adjustment, and I'm just going to stretch her out a little bit.
Thank you.
Yeah, good. Excellent. Okay, so now we got her stretched out. So what I'm going to do, I'm going to contact on this, just the back side of the ilium here. So I'm going to adjust the sacroiliac joint. So here we go. I'm going to adjust that using the drop a little bit. It's very comfortable. There we go. Okay, now I want you to lay on your left side, okay?
Okay.
And again, one lady I remember a few years ago said turning on this table is like turning on a 2x4, so. All right. Okay, Loretta, so we're gonna pull that around. Okay, now stretch you out a little bit. Okay, now I'm gonna contact down here. Okay, I want you to lay on your back. Good. All right, there we go. Get you kind of centered there. Okay, so we're going to take a look at her leg lengths now. And she's got a she's pretty even up. I've got a little bit more to do. I'm going to just adjust her feet right here. There we go. Okay, you okay? Okay, good. Here we go. Okay, now, one of the pressure points that I like to work on is called the iliopsoas muscle. It's a hip flexor muscle. So you work on this. I'm coming in right on here, right close to the ilium, the front side of that ilium, and you work the pressure points. Is that okay?
Mm-hmm.
A little tender?
Right.
A little tender to the touch? Okay.
Right.
All right. And we're going to go over to the other side. Okay. Good. These were much more tender on Loretta when we first started, right?
Right.
Yeah.
Yeah,
yeah, she's gotten a few adjustments now. She's doing a lot better. Okay, so what we're going to do now, I'm going to go ahead and I'm going to work on her cervical spine, okay? So, all right, so here we go. Okay, now what I'm feeling for is just the joint, the neck vertebrae, just feeling how they're moving. And so what I'm going to do, I'm going to adjust this first and second cervical, then we adjust the second cervical vertebrae actually, right, like this. Okay, now let your head relax. There you go. Okay, good. Whoa. All right, yeah, there you go. I just released a whole bunch of power there. We got the power is going to get to her body a little bit better. Now we're going to do a first cervical vertebrae adjustment on the right. Just let your head relax. Now I'm going to do a little stretching here. Just get this neck stretched out a little bit. Make the adjustment go a little better. Okay, so there we go. That's going to be easier. Okay, so let your head relax right there. There we go. Okay, good. How was that? Is that okay? All right. Excellent. All right, and now I'm going to pull just a little bit. Okay, good. Okay, so, all right, that feels pretty good. Yeah, a little tender there. I'm going to do a rib cage adjustment here, and we're going to set up the thoracic drop piece here. Okay, and go ahead and put your arm down now. So her rib cage is shifted up on the left, and so we're going to get that adjusted now. Okay, there we go. Okay, now I'm going to take her left arm here. We're going to do a little bit there. Okay, good. All right. Usually that's a little bit better. Is that a little
Right.
better there? Okay, a little bit less tender, and I can feel that the rib cage is now shifted down and even up to the right side. So good. Let's do a little bit right here. Adjusting with this Thompson table gives you a lot of a lot of leeway on adjusting, or you can adjust the spine with different amounts of force and such with this drop mechanism, so really good to use. Okay, there we go. Okay, so that is that. Lastly, I'm just going to recheck her leg lengths to make sure they're good to go. And that looks really good. And how's that feel, Loretta?
Good.
Okay, outstanding. Let me bring you up. The sigh of relief, right?
Right.
Okay, go ahead and step off there.
Do I have to?
Yeah. I guess we could let you have the room for a little while. All right. How's that?
Ooh,
That feel better? Okay.
good, baby, go to sleep.
All right. Very good. Well, thanks for watching.